Welcome to the Hashimoto's Doctor podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hey guys, Dr. Shook here. I hope you're doing well today. In today's podcast, I want to talk to you guys about a really important topic that I know you probably are not familiar with, the far-reaching implications of what we're going to discuss. I know you think you know what we're going to talk about, but I promise you that you don't. So stay with me, okay? I promise to make this worth your while. Because what we're going to talk about today is your hemoglobin A1c, which is a way to look at your blood, your fluctuations in blood sugar over a longer period of time. This is really important if you're autoimmune, if you have Hashimoto's, if you're dealing with any chronic health condition, guys, any chronic health condition. You just name it. Really, this is, if you're looking at, heart disease or dementia, autoimmunity, a lot of these things, and, obviously diabetes, because we're talking about blood sugar, this is a really important factor and something that you absolutely have to understand. And so few people truly understand the many factors that affect our blood sugar regulation, and this is critical. It's absolutely critical. This is one of the top 3 things that I look at when I'm trying to help someone improve their health. One of the first things I'll look at are their inflammatory markers and levels of inflammation. The second thing I'll look at is their red blood cell health, their white blood cells, to see what's going on there. Is there an immune response occurring? Are they anemic? Do they have problems delivering oxygen because of lots of different reasons create anemia, but it's a problem with the red blood cells and inability to efficiently carry oxygen through the body. Those are huge deal breakers. And the third thing I look at are these blood sugar markers, especially the hemoglobin A1c, which is looking at glycated hemoglobin. And it's really, we often refer to it as a more long-term view of your blood sugar and blood sugar fluctuations. And we oftentimes will say it's a 3-month marker. But the reality is that the reason we say it's a 3-month marker is because, in general, the average person's red blood cells are going to live for about 3 months before they're recycled, okay, before they're broken down and recycled. The fact is, though, is that some people, their red blood cells may live for 5 months. So this may be a much longer way to observe blood sugar fluctuations. But some of the things that you've got to understand here, guys, is that high blood sugar fluctuations, it triggers chronic inflammation, and it sets the stage for autoimmune diseases like Hashimoto's. It's absolutely, if you're autoimmune, you have to focus on this. This has to be a core strategy to help you get well. Because I'm telling you guys, this is something that will prevent you from getting well, and no one makes the connection, okay? Your doctors don't realize this functional relationship, but it's there, and it definitely, these fluctuations in blood sugar, they spike interleukin 6, okay? It's an inflammatory chemical, and what it will do is it drives tissue destruction. It's a chemical messenger for the immune system. So you don't want to promote inflammation. You don't want to do that. It's not a good scenario, especially with autoimmunity. Now, the other things that it really does is it wreaks havoc on your hormones. Havoc. It is what, the leading theory, and it's pretty solid at this point as far as the main driver behind PCOS, polycystic ovarian syndrome, the most common endocrine disorder in the United States in women. And that's a huge issue because the blood sugar fluctuations up and down, it really promotes, it shifts enzyme activity and enzyme levels in the body. And it creates this environment where your body converts a lot of your hormones into testosterone. And it will create the formation of cysts and lead to a lot of other negative health consequences. And it will throw off and imbalance the rest of your hormones. So it's really a significant impact on those problems. Listen, if you have hormonal imbalances, the last thing that you can afford to do is have blood sugar. It's really the abnormal blood sugar. You've got to focus on stabilizing your blood sugar. I can tell you that as a primary approach. Now, beyond that, it damages the walls of the blood vessels. It can damage brain tissues, and it can really accelerate brain aging. So there are a lot of things here, and you guys may be familiar, you should be familiar with some of these concepts. I hope you are. But it's also implicated, one last thing I want to say about the brain is that it's implicated in type 3 diabetes. Right, type 3. You guys know about type 3 diabetes yet? If not, I talk about it some. I've mentioned it before. Type 3 diabetes in the scientific literature is one of the subtypes of Alzheimer's. They've really looked at Alzheimer's disease, and they're breaking it into a lot of different subcategories. And blood sugar driven is one, infectious, traumatic. There's several different, they've got about 5 or 6 different subtypes of Alzheimer's. So different drivers or causes of it. But guys, this is absolutely unbelievably important. It's really critical that you focus on blood sugar regulation. And the two things that people don't realize, it's not just diet and exercise. It comes down to being able and improved diet and exercise is one thing, but your cortisol levels, the stress hormone cortisol, is diabetogenic. If it's high, it promotes diabetes. That's you cannot have that. Obviously, you cannot have that. Yeah, and how many people's doctors check cortisol for their diabetes? Almost none. So what we have to do is we really have to focus on regulating the blood sugar, not only through a dietary and exercise perspective, but really you've got to look at cortisol levels. And there are a lot of ways to improve cortisol. We can do it naturally. There's a lot of ways we can support optimal cortisol function. Now, even beyond cortisol, the second thing that's almost never looked at are your inflammatory levels. Listen, guys, if you have a high inflammatory load, high C-reactive protein, homocysteine, if you're autoimmune and the autoimmunity has not been worked up as far as looking at the driving factors of the autoimmunity, then you're really going to be likely to have high inflammatory levels called cytokines. Now, I mentioned in interleukin 6 earlier, an inflammatory cytokine, and that is a huge issue because these cytokines can dampen your hormonal sensitivity, and you don't want to lose hormonal sensitivity to any hormone, to thyroid hormone or to your insulin, because that can create major problems for metabolism and for blood sugar regulation and utilization. But anyway, I wanted to hop on here, guys, share this with you for a few minutes and really give you some really empowering information, some things to help you get a better perspective and take your health back. But I appreciate you hanging out with me today. I hope this has added value to your life, and I can't wait to talk to you guys again soon. Have a wonderful, wonderful day. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.